Hello, everybody. Welcome to the seminar Understanding ADHD and its Homeopathic Management by Dr. Kavita. She's been a homeopath for the last 10 years, and she works with Nirali Health Center, which is a part of the L&T, and she does a lot of work with children, which is where I think her interest in ADHD is increased. And we've asked her to come and share her knowledge with us regarding ADHD and its homeopathic management. Dr. Kavita?
Yes, thank you for the introduction, Karthik sir. I'm really grateful to you to open up this platform for so many doctors to learn and share their experiences in the most testing times of COVID. Thank you so much. The entire team of I Love Homeopathy.
Thank you.
Sir, I'll have to start sharing my screens now, right? My slides.
Go ahead. Yeah.
Okay. Friends, good evening and good morning, and hope you all are in the best of your health. Today, I'm going to share my understanding about ADHD in the past 10 years with special interest in pediatric cases. So, this topic is very, very close to me, and I hope I present to you in the best way I can. Okay, so ADHD, that is Attention Deficit Hyperactivity Disorder, is a behavioral disorder characterized by inattentiveness, impulsivity, and hyperactivity. So, what's the difference between a very active, inquisitive child and a child with ADHD? So, kids are naturally active and inquisitive, some are more than others, but this is not a cause for concern. This is a normal part or a typical childhood developmental behavior or their personality. But if a teacher or a daycare provider points out problems or difficulties with a child's behavior, then it is worth taking a closer look at it. So one of the main difference between a normally active child and a child with ADHD disorder is that the disorder interferes with a child's function, his day-to-day tasks, and even social compatibility. And this is a time we need to seek help of a doctor, of a psychologist, and a doctor will examine a long list of behaviors and he may suspect ADHD when many of the symptoms keep occurring often. A doctor will evaluate a detailed, complete history of the child, even get into the details of the family history because ADHD tends to run in the families. And a doctor will even have a questionnaire prepared, and then the diagnosis would be made of this disorder. Now, let us understand the types of ADHD. There are three varieties of ADHD. The first is a combined, second is impulsive or hyperactive, and the third is inattentive or distractibility. Commonly in practice, we come across with a combined variety of ADHD, which is impulsive hyperactivity as well as inattentiveness in a child. Coming to the causes or risk factors, let us understand this much more in details. The cause could be low levels of dopamine. Premature birth could risk ADHD. Maternal drug use or alcohol or smoking during pregnancy. And as I said earlier, ADHD tends to run in families. So genetic factor is very important. A child with ADHD has a 1 in 4 chance of having a parent with ADHD. And the last cause or a risk factor could be exposure to environmental toxins like lead. Now, let me highlight one point over here is exposure to screen time or video games in the first 5 years of life haven't proved to be a cause or a risk factor to ADHD. Also, sugar, processed foods, or packed foods, or flavored foods, or candies. There is no evidence of these causative factors or risk factors towards ADHD. ADHD is noticeable as early as 3 years of age, and the presentation could be mild, moderate, or severe. ADHD in childhood may continue in adulthood, and the incidence is more common in boys than girls. Karthik sir, is there any technical issue? One of the participants has a query about it. Okay, I'll continue. Now, let us understand the symptoms in details. They are categorized into two sets. One is hyperactivity and impulsivity, and second is inattentiveness. So, coming to the hyperactivity and impulsivity category, we see a lot of interrupting behavior in a ADHD child. So it could be that the child butts into the conversations, or if there are a group of children playing some games and they are not a part of it, they would interrupt, they would interfere, make loud noises, and try to show their attention. They're always in a motion, always on the go, cannot sit in one place. And the teachers, more importantly, give this very common symptom that they cannot wait for their turn. So if the teacher starts with any activity or assigns them any activity, these particular children will run and start doing the activity. They cannot be patient enough to wait for their turn. They're very fidgety. So in a classroom, the teacher will observe these kids being very fidgety with their crayons, with their pencils, or keep constantly banging their chair, or uh, keep playing with their textbooks, or keep flipping the pages. A typical fidgety behavior. They are very loquacious, very talkative. They have a trouble playing quietly, and they blurt an answer before the question has been completed. This is again a very telltale symptom of ADHD. The second category is inattentiveness. So, ADHD kids tend to make careless mistakes. Now, let me tell you that the mistakes are not an indication of laziness or lack of intelligence. It is because they do not follow instructions. They're always hasty and hurried and worried. That is the cause of careless mistakes. The second most important is forgetfulness. So they may forget their compass box or their crayons or their pencils, and they even tend to lose their things, lose their toys. Lack of attention in any task or play, and they're not able to complete any task. Even their day-to-day domestic chores, they're unable to complete the task. And the effort, the task which requires a lot of mental effort like homework, they tend to avoid or dislike. And as I said earlier, they don't stay on any task. Very interesting to see coexisting conditions along with ADHD. They can be conduct disorders like stealing, fighting, harming people or animals. ADHD can be seen very commonly nowadays with a lot of learning disabilities, with substance use disorders in adults who continue with ADHD right through their childhood, or could be existing with anxiety disorder or mood disorder, or even commonly seen nowadays is autism spectrum disorder or tic disorder. Coming to the next very important point is the management. So, friends, let me emphasize on this point. It is a teamwork. Managing ADHD with autism or with any learning disability or just a combined variety of ADHD is an absolute teamwork. So, a total medical evaluation by a psychiatrist, by a psychologist, and a pediatric neurologist in a few cases is very important. Yes, we have a wonderful role of homeopathy, which I shall be discussing in my further slides. The role of a psychologist is to assess the child periodically and, even very important, to counsel the parents. The turmoil the parents go through with an ADHD child has to be allayed, the anxiety of the parents has to be allayed, where a psychologist and a homeopath plays a very important role. Another important point is timely assessment by school teachers, and even occupational therapy is very important. And prognosis is good if understood and treated early. Because children with ADHD struggle with low esteem, with troubled relationships, and with poor performance in school. So some symptoms lessen with age, however, some never completely outgrow the symptoms. So early diagnosis and treatment can make a very huge difference in the outcome of managing ADHD kids. Coming to the homeopathic drugs, before starting with the pictures, I would like to say that a detailed history in homeopathy is very important, right from the physical generals to the physical particulars to the mentals. And very important point is a mother's history during pregnancy, which helps us to, which is a crux of the homeopathic case taking in an ADHD child management. So these are the common drugs. These are not specific. Let me tell you again, a detailed case history with a lot of keynotes, with a lot of particulars will help us to break the case and derive to a simillimum. So the first common remedy which comes across is calcarea phos. Children are very delicate, tall, thin, scrawny, with a dirty brownish skin, very restless. They want to go home. And when at home, they want to go out and they keep moving from one place to another. They have a great desire to travel. And they do not like school. They do not like completing their school homework. These kids tend to cry in sleep. They are very peevish and fretful. And very common, what we observe is complaints aggravate while thinking of them. This is very typical of a calcarea phos child. Another important thing to highlight is that the dentition is very slow in calcarea phos kids. Another observation is slow learning to walk and delayed closure of fontanelles. Next remedy that we come across very frequently is chamomilla. Very irritable, fretful, peevish, and angry kids, very uncivil and spiteful behavior. The common constitution of a chamomilla child is light brown hair of an irritable temperament, and capriciousness is the telltale of chamomilla. The child whines and cries and wants something new every minute. If given something like something to eat or a toy to play, they throw away in anger. Anger is well marked in this remedy. Child is very snappish, cross, and uncivil, very quarrelsome. And a highlighting feature is that they omit words while writing and speaking. They are very impatient also. They want many things, and when they are offered, they refuse it. And mental calmness contraindicates a chamomilla prescription. And another striking feature of chamomilla that we all know is they are quiet only when carried. Another interesting drug that we come across with ADHD kids is Sina. It's a very fantastic worm remedy, as we all know. And Sina has a very marked touchiness, both mentally and physically. Mentally, the touchiness is marked by a lot of irritability and anger, and physical touchiness is marked by sensitiveness of the skin, by touch, um, and this is suited to children who are fat, rosy, and scrofulous. They do not want to be touched or carried. They are aggravated by being looked at from seeing strangers. This is another feature of being touchy, and a lot of temper tantrums. So, again, same indication of Camomilla, like the child wants something, but he does not know what. They desire many things, but when they are offered, they reject. And a very interesting feature about Sina children is they hate going for a haircut. They have desire for sweets and various undigestible things. And the most characteristic is that a Sina child would be sleeping in a knee elbow position. Coming to the next drug, we have lacases. Lacases is a very deep and long acting polycrest remedy. Again, sensitiveness is greatly marked to touch, sensitiveness to touch all over the body, especially head and feet. And they cannot bear to be touched, which causes a lot of uneasiness. They hate wearing tight clothing also. They have a great desire for fanning, though a slow speed of fan and from a distance. And interestingly, Lacases children are very suspicious, very jealous. And when a child is brought by the parents for behavioral and emotional problems, typically after birth of a new baby in the family, which leads to jealousy towards the sibling, one can think of Lacases. And they're very smart kids. They play tricks on teachers, very abusive also, and they insult parents, very loquacious, and they have special love for animals, especially cat. They have a lot of difficulty in concentration, in completing their homework, or when it comes to mathematical calculations also. Like cases, child finds it difficult to read. I'm sorry for the interruption. Very well marked is religious affection in children. The next interesting drug that we come across is hyoscyamus. There is a lot of increased cerebral activity in a hyoscyamus child, and he has a typical desire to uncover himself, and every muscle twitches from eyes to toes. It is suited to children who feel neglected by mother after the birth of a new baby, and he has poor control over his impulses like talking, joking, throwing tantrums. A typical feature of a hyoscyamus child is a desire to bite everyone who disturbs him. So, this a teacher would definitely point out to the parent that if there are any kids who make mockery about him, he would just go and harm them by biting. They have a great desire to break things, very violent kids, antics play, desire to uncover, very destructive and malicious, but a very special feature of hyoscyamus. They have a artistic aptitude. They love to paint. They love to splash colors and make some amazing drawings and sketches. Next drug we come across is tarantula. Tarantula kids, as we all know, that the spider group is the best fitted into the picture of ADHD management. And like a spider, they are very, very restless. They're constantly in motion. Cannot keep quiet in one position. They have to keep moving around. There are a lot of irregular movements and a constant movement of legs, arms, and trunk. They break tear away their notebooks, tear away the assignment sheets also, and they throw things around in anger. A lot of laughing, mocking, running, dancing, gesticulates, joking, crying, and singing till a tarantula child is exhausted. They can roll on the ground side to side or strike vehemently. And this is commonly observed and told by the parents. And this behavior is commonly seen in malls where the child demands something, and when refused, they will keep rolling, and this typical behavior of striking. They're also called as Popeye baby because of the constant motion. Next we come across is tuberculinum, very abusive children, and they have a desire to use foul language. A very chilly patient, a very chilly child. They have fear of animals, especially dogs and some insects like cockroaches and lizards. Tuberculinum is suited to children with light complexion, narrow chest, who are mentally very active and precautious. And restlessness in TUB is more of desire to wander. They are very sensitive and worse from music, very obstinate and disobedient children, and they are indifferent to punishment and reprimand. And symptoms keep changing in a TUB patient. You know, they begin suddenly and cease suddenly. This is another characteristic of TUB. Coming to the last drug picture is Virat Al. They have a very marked craving for acidic or refreshing things, fruits, juices, cold food, and cold drinks. And they have cold perspiration all over the body, especially on the forehead. Overstimulation of mind in a virile child is eventually reflected with restlessness, and they have a lot of repetitive behaviors such as stacking up things or cutting papers into small bits. They show no emotion even when reprimanded. They feign their illness to get sympathy from parents, from teachers, or from their daycare providers, and very arrogant and rude children. And the most important is we see the mania, that is the violent mania of belladonna, religious mania of stramonium, and a lascivious mania of hyoscyamus in a virat al child. Very destructive, and they throw things in anger. Coming to the supportive treatment, this is what I always share with my colleagues and my students and my patients, especially parents who deal with ADHD kids. These are golden words given by a very senior pediatrician, Dr. Ram Subramaniam, who practices in Thane. And they are the golden words to be used every day in practice, managing pediatric cases. So never use the 3 C's with children. Never criticize children, never condemn them, and never complain. And always LAA is always show love, show affection, and keep appreciating kids. This helps in a long way to build up relationship with a child and to build up the confidence in a very young ADHD child. Next, coming to the assessment, let us understand how to assess an ADHD child. A detailed parent's interview is a must. Verbal and attention skills of a child, the cognitive development, and very important is academic performance given by the school teacher, the ability to finish off their day-to-day tasks, and last but the most important is assess their interpersonal relationships with family, teachers, and peers. Coming to a case discussion, I have a very interesting case of ADHD with delayed language development. So let us go through the case. He's a 4-year-old child. All of my pediatric patients are favorite. This one is a little more close to me. He was referred by a clinical psychologist and even assessed by a psychiatrist and a pediatrician. And this case was seen in July 2018, and the details were given by mother. Very restless child, cannot sit for more than 1 minute, very anxious, pushes children in school. He has to be forced to do his basic chores like brushing and dressing up. uh, the most important, when the parent realize that there is something, some difficulty in his behavior or some challenges which are coming up in his way, was when the teacher complained that he is inattentive and the language development was delayed. He could only speak Ammi, Abba, and Apa. So Ammi means mother in Urdu, Abba is father, and Apa is the elder sister. And he could only express in a few words like khana, pani, sona. Khana is food, but he was not able to frame sentences like mom, please give me food, or mom, I want to sleep, or mom, I'm very thirsty. He would only use food, that is khana, or pani, that is water, or sona, sleep. Mother was very upset with the school teacher's remarks, as I told you earlier also, that the turmoil what an ADHD parent goes through is beyond imagination, and it breaks the heart of a mother when a school teacher passes some remarks. So uh, we need to be very very patient with ADHD parents too, and keep counseling them time and again. The screen time was 4 to 5 hours daily, which is too much for a 4 years old child. And he even presented with recurrent cold cough, which was aggravated by change of weather, dust, fried food, cold drinks, and a lot of dental caries, which kept recurring since almost 12 months. Coming to the physical generals of this child, he was a very lean, thin child. Appetite was normal as described by mother. He would eat all his 3 meals merrily. He's not a fussy child at all. Craving was very well marked with cold drinks and salty food. And coming to aversion, there was nothing specific that the mother noticed. And thirst, it's quite thirstless child. Mother had to remind him to drink. So she would offer him a glass of water and he'll have 2 or 3 sips and again give back. But never he's come and told his mother that I want to, mother has to remind him for water. Stools as bowel movements was is once a day, quite a satisfactory movement and no complaints while passing urine. Sleep quite refreshing for 8 to 9 hours and a very chilly patient. So, as I told you earlier, mother's history during pregnancy is very important. But surprisingly, his mother did not have any major complaints. Only there was morning sickness during the first trimester and a full term normal delivery with a birth weight of 2.9 kgs. Coming to the milestones, again, very important to assess an ADHD child. He had delayed dentition, delayed talking, and the anterior fontanelle closed at 24 months, which is usually around 16 to 18 months. So I took it as a very important symptom of delayed closure of anterior fontanelles. Mentals of this child, he loves traveling and loves spending time with his elder sister. He misses his father who works in Dubai, and the father visits them once a year and tries to spend a lot of time with his child when he's back on a break for 2 to 3 months. So, this is a detailed case history. And coming to the most important part is this is the crux of case taking, which is observation. In my OPD, I let the child behave the way he wants to. I never stop him. So my observation with this child was that he kept opening the drawers of examination table. He climbed up the table, jumped, picked up the stethoscope, played for a while, and again kept it back. Not at all a destructive child. And very important, coming to the advice that we as physicians should give to the parents is to manage an ADHD child or any pediatric case. I always tell the parents to engage them in some household work. An outdoor play for 1 to 1.5 hours is very important for an overall development in a child. You should allow them to splash the colors, scribble the walls with crayons, play with mud or clay or sand. And music therapy is also very beneficial with ADHD kids. Musical instruments, yes, plays a very important role, but musical instruments can be introduced after the age of 5 years. This is what we follow in India. Any school of music permits admission to kids at the age of 5 years. So I advise only for the music first, music listening, and then learning the sargams. Coming to the repertorial analysis, I took up the rubrics restlessness, nervous tendency, travel desire too, because he had a marked uh, love for travel. I took the physical generals, desire for cold drinks and desire for salty food, and dental caries, decayed hollow. Now, the three remedies which came up were Merc Calcarea, and Calcarea Force. So, going back to our Materia Medica source books and comparing, Calcarea Force fitted into this picture because of the chilliness that the patient presented, the thirstlessness, and even a marked craving for salty food and a marked desire for travel. Uh, so, with the first prescription of Calcarea Phos in July 2018, there was not much of a difference in August 2018. And I again advised 2 doses to be repeated once in 15 days. In September 2018, this child started showing interest in coloring, sticking activities, and started combining 2 words to frame his sentence, like khana do, meaning give me food, or I want water. I am thirsty, or I want water. Pani chahiye. And at this point, I appreciated mother's efforts. She was very happy with the slight improvement also, which was seen with the child. I repeated Calcarea Force again, 1 dose in September 2018. And in October 2018, interestingly, mother started with alphabets and numerals. His attention span was minimum, but it increased to 4 to 5 minutes, which was earlier only for 1 minute. And every day, he looked forward to go to the garden for his outdoor play. He started communicating and playing with other kids. His pushing habits also stopped in school, and he loved doing his coloring activities. I repeated again Calcarea Phos 1 dose and called the child after a month for assessment. So, cutting it short from November 2018 to August 2019, in 10 months, the child showed a remarkable improvement. He started framing sentences, he completed his tasks, and only one episode of an upper respiratory tract infection which settled within 2 days. I asked the mother if there was any need to give any anti inflammatory or any decongestant medicine. She said no, he healed and improved by his own. Then in September 2019, he came up with a complaint of tinea versicolor, where I thought I would repeat the constitutional medicine. I gave him 2 doses once in a week. But if I show you the slide, there was not much major improvement with the constitutional medicine. I had very less time to treat him because in October, he was supposed to go to Dubai and spend time with his father. So I gave him 2 doses of Nozode Basilinum 200, and you can see the improvement in 15 days. The tinea versicolor completely disappeared. And I met father for the first time. He came to pick up his family and take them to Dubai for 2 months. He was overjoyed to see a phenomenal change in his son. And this was the victory of this case, victory of calcarea force, and victory of a simillimum. I hope this case has some. I've just shared my experience, and this is a fantastic case. A child is very, very close to my heart. So this is my part of presentation. If there are any questions, I will try my best to answer them, or you all can email me. I will be happy to answer to all your queries. So we can't hear you.
So yeah, does anybody want to ask Dr. Kavita anything? It is still, thank you. So tell us this, Dr. Kavita, when did you start getting interested in ADHD and
So
or
I did
what
my
made
post
you?
graduation. I did my post graduation in pediatrics in 2013. I passed out, and I started seeing cases. And my mother, also being a homeopath, I loved treating kids and a special bonding with them. So that is what got me very close and inspired me to start treating ADHD kids. Yeah.
Bacilli- Bacillinum on what basis?
Yeah. Pratna, as I had very less time and I tried using calcarea force, which is this constitutional medicine, it did not help much. So I changed the prescription because tinea is a fungal infection and Bacillinum mosode works very well in cases of fungal infections, in cases of tinea. There is one more possibility. I could have increased the power of calcarea force to 1 mn given, but Bacillinum showed improvement. And the anxiety also what I had because the child had to travel, I selected a nosode for helping with his tinea versicolor. Yeah.
Dr. Irina, I would like to
Yeah.
know,
Do you also add
you,
supplements, omega 3 or similar while treating ADHD? No, I haven't used any supplements coming to the homeopathic management. And even when this child was assessed by a pediatrician and a psychiatrist, no supplements were used. Only the clinical psychologist helped him with some basic day to day exercises, which even the mother followed at home. This is a vast topic of what to ADHD and autistic child, what are the complications and what they develop in their adulthood. So, Dr. Deepak, if you could just share the email ID, I will send you links of it. There was again one more question on ADHD and autism. I would like to answer them in details. I'll shoot an mail to them.
yeah.
Yeah. Thank you. Thank you.
And for all those who missed parts of this, there's a recording which you get an email once the recording is up on the site. You can go and see it as many times. You can share it with your friends who weren't able to come. Please send email ID. Email ID for Rufino. I also want details. Oh, yeah. They're asking for the your mic is muted.
My email ID is on the screen, but
Email ID is on the screen. Yes, so they can all take it down.
You can write to me. Any other questions relating to the case? Be happy to answer them. I'll try my best to answer them. Thank you, Dr. Irina. Great
There's
case.
nothing else. I'd like to close this webinar. I'd like to thank Dr. Kavita for sharing all the knowledge that she has, and hopefully we'll see more of her on our channel. More
Yes,
topics,
sure.
maybe a little more intensive sessions on ADHD and autism.
Yes, yes. I have some
Okay.
beautiful presentations of autism also. Um, yes, I have three case presentations. I will definitely like to share with everyone about autism.
Thank you so much. Thank you so much for being with us, Dr. Kavita, and thank you
Thank you,
all
Karthik.
participants for coming in. And once the recording is up on the site, you'll get an email, and you can go in and see it as many times as you want. All the other earlier webinars are also there on the site, so you can have a look at all of them. If you haven't registered before, you can just sign in and you can see all the earlier webinars. So thank you very much. Thank you for coming, and we hope to see you all again very soon.
Yeah, thank
Our
you all
next
the
webinar,
participants,
yes, the next
and thank you,
webinar is
Karthik.
by, thank you. The next webinar is by Dr. Gaurang on no sodes. We'll be sending you an emails in the next day or two. So hope to see you all there. Bye bye. Good night.
Wishing you all the best of the health. Be safe, and you all can write to me. I will share my presentation also with you all. Thank you so much. Be safe and be healthy. Thank you, Karthik sir. Thank you so much for
Bye.
giving me this opportunity.